House Bill 3090, relating to hospital discharge procedures and prescribing an effective date.
Question now rises upon third reading and final passage of House Bill 3090A. Representative Keny-Guyer.
Thank you, Madam Speaker. Colleagues, I'm going to be talking about this bill and then another bill, and I want to give a little history since many of you are new. I am introducing this time House Bill 3090, and this builds on significant work done over the last few years. I began working on mental health issues with Jerry Gabay soon after becoming a legislator in 2011, which was not long after his daughter Susanna died of suicide at age 21. Since then, I have heard numerous other stories about families who lost or almost lost a beloved family member, often at a tender young age, to suicide. Sadly, suicide is a major issue in our state. For years, Oregon is ranked between 7th and 9th in the U.S. for suicides, and this has been increasing since 2000 at a faster rate than the national average. Suicide is the leading cause of death among young Oregonians aged 10 to 24. Second leading cause of death. In response, I worked on 3 bills for several months prior to and during the 2015 session with Jerry Gabay, Julie Majors, other families and mental health consumers, providers, payers, state and county policy staff, and legislative colleagues, many of you in this room. We passed 2 of the 3 bills in 2015. The first one, House Bill 2948, called the Susanna Blake Gabay Act, clarified HIPAA parameters in order to encourage healthcare providers to encourage patients in acute mental health crisis to discuss follow-up care with their family or chosen family members and peer support. House Bill 2023, the second bill we passed, asked hospitals to develop and implement discharge policies for patients who are admitted for a mental health crisis. Not all hospitals can admit patients, so we limited it to the hospitals that could admit patients. The Hospital Association did a great job of developing those policies, and we are now following up with them to see how well the policies are being implemented. Over the last 2 years, the large stakeholder group, made up of 2 to 3 dozen people at each meeting, continued to meet to further advance the goals of the 2015 bills. The results are now House Bill 3090A and 3091A. While House Bill 2023 only referred to hospitals that admit patients into psychiatric care, today's House Bill 3090 asks the remaining hospitals that do not have the capacity to admit patients to develop policies for the release of patients from their emergency departments for a mental health crisis. Those policies should deal with the issues. The bill asks for them to deal with the same issues that were included in House Bill 2023. These include encouraging the patient to sign an authorization to disclose information necessary for a lay caregiver to participate in the patient's discharge planning and to provide post-discharge or post-release support. Discussing the patient's prescribed medications and the circumstances under which the patient or their caregiver should seek immediate attention. And then lastly, developing a process to ensure coordination of the patient's care and a seamless transition from an acute care setting to an outpatient treatment. Like House Bill 2023, in House Bill 3090, the policies must be publicly available. There are 2 ways in which we ask hospitals to actually go farther than we did in 2015. The Suicide Prevention Alliance, which resulted from another bill passed in 2014 on mental health, sponsored by Senator Sarah Gelser, has now developed a lot of guidelines for best practices around suicide prevention, and these deserve consideration by the ER departments as they develop these policies. So this bill asks them to consider policies around suicide prevention, such as a suicide risk assessment, a follow-up appointment that's ideally done within 48 hours, access to a 24-hour hotline, suicide prevention hotline, and lethal means counseling. The second requirement is for a report back from the hospitals by January 1st, 2018 on how the development and implementation of these policies is going. Since we know the smaller hospitals often lack the capacity to do many of the goals in this legislation, we want to understand the barriers, whether they be workforce shortage, lack of reimbursement by payers, and or lack of mental health education and training, so that we can attempt to address this in future sessions. With that, colleagues, I urge your vote for this bill.
Thank you, Representative. Further discussion?